Hello, my name is Vincent Garcia and I am doing my video on the autism spectrum disorder with an emphasis on autism itself. ASD covers 5 different syndromes, which are autism, Asperger's syndrome, Rett syndrome, childhood disintegrative disorder, and pervasive developmental disorder not otherwise specified. The National Institute of Mental Health has given this definition for the autism spectrum disorder. Children with ASD do not follow the typical patterns of child development. In some children, hints of future problems may be apparent from birth. In most cases, the problems in communication and social skills become more noticeable as the child lags further behind other children the same age. Some other children start off well enough. Often between 12 and 36 months of age, differences in the way they react to people and other unusual behaviors become apparent. Some parents report the change as being sudden and that their children start to reject people, act strangely, and lose language and social skills they had previously acquired. In other cases, there is a plateau or leveling of progress so that the difference between the child with autism and other children the same age becomes more noticeable. ASD is defined by a certain set of behaviors that can range from the very mild to the severe. To focus more on autism itself, the federal government's Office of Special Education Programs has given this definition. Autism means a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before the age 3. That adversely affects a child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotyped movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. Autism does not apply if a child's educational performance is adversely affected primarily because the child has an emotional disturbance. One of the main challenges for children with autism is their lack of ability to communicate. This can become increasingly frustrating for the child with the disability as well as the parents of these children. Their patterns of language can be rigid or repetitive. Many children with autism do develop some sense of language, but not to the normal level of ability. These children display poor nonverbal conversation skills as well. All of these language challenges also make it hard for these children to socialize with their peers. The characteristics of autism usually fall into 3 areas in which they are affected. These are social interactions, communication, and restricted range of interest or behavioral repertoires. With regards to social interactions, some of the characteristics that stand out are the lack of normal attachments to parents or other family members, lack of the development of friendships with peers, lack of empathy and affection, and lack of observed peer play. As for poor communication abilities, these children may never fully form or master a functional language. They may not be able to understand gestures, facial expressions, and nonverbal cues. Their speech can be meaningless and repetitive, and they have difficulties in maintaining conversations. These children often display an insistence on sameness as well. They can ritualize their daily routines, minor changes in environment can cause distress, and they can display obsessive and compulsive behaviors as well as stereotypic behaviors such as rocking or hand flapping. Self-stimulation such as twirling objects is often displayed in these children as well. According to the Autism Society, 1% of the children in the United States ages 3 through 17 have an autism spectrum disorder. It is estimated that 1 in every 88 births are diagnosed with the disorder. Approximately 1 to 1.5 million Americans live with this disorder. It is currently the fastest growing developmental disability with a 1,148% growth rate, with a 10 to 17% annual growth rate. This is a graph showing the prevalence of autism spectrum disorder throughout the United States. As you can see, from the years 1975 to the year 2009, it has raised from 1 in 5,000 to 1 in 110. And as I have stated before, it is now in the year 2013, 1 in every 88 children are diagnosed with the disorder. As of right now, we are not sure what exactly causes autism. Scientists and researchers have been using a process of elimination to figure out what does not cause the disability. Many agree that autism is a neurobiological disorder that has a genetic basis. Being that the rise of autism has taken place within the last 20 years or so, researchers expect to find more information in the coming decade. One theory that has been widespread is that the disorder is caused by the measles, mumps, rubella vaccine. Although there is a lot of research showing that it is not the cause, parents have been withholding the vaccines from their children. There have also been parents who decide to give their children the shot separately as opposed to all of them at once. However, because we know so little about the disorder, we are also not sure what prevents it. As of right now, early identification and intervention are our best tools against the disorder. Children with autism can be diagnosed as early as 3 years old. There are tests that, coupled with parent reports, can now identify these children earlier than we were once capable of. These tests are called the Autism Diagnostic Observation Scale and the Screening Test for Autism in 2-year-olds. The children can be tested at 2 because typically this is the age at which they begin to develop spoken language. Therefore, the tests also examine the child's ability to imitate motor movements. Researchers are currently working on an even earlier identification. By studying videotapes of children at their first birthday parties, Julie Osterling and Jerry Dawson were able to distinguish 4 characteristics that were displayed by children who were eventually diagnosed with autism. They were the lack of the child using a finger to point at an object, the absence of the child showing their presence to others, they did not respond to their names, and they did not make direct eye contact with others. As I had stated earlier, one of the best tools we have in dealing with autism is early intervention. One must make sure that the program which they choose for a child contains key elements in order to have any success. These programs must include supportive teaching environments, plans for generalization, predictable and routine schedule, and behavioral approaches to address problem behaviors, supports for program transitions, and family involvement and support. Next, we will look at 2 programs that have gained a lot of notoriety over the years. The first of these programs is called TEACH. TEACH was developed at the University of North Carolina. The program emphasizes the importance of structured teaching, which uses visual aids are used to help students comprehend their environments. Once the children acquire these skills, independence is started to become the emphasis of the program. The developers of this program feel that children with autism are missing skills that cannot be learned, but they can compensate for them using visual supports and other forms of structure. The program is individualized and provides families with the necessary support through training and collaboration. Another popular program is called the Young Autism Program. This program evolved out of the work of O. Ivor Lovaas at UCLA. This program has also been incorrectly labeled as applied behavior analysis. In this program, the children usually spend about 40 hours per week using the principles of behavior analysis, which was derived from the work of B.F. Skinner, and uses single-case designs to show paradigms describing human behavior in terms of events that stimulate or cause a behavior's occurrence. The goal of this program is to teach children one skill at a time that will help them independently participate in all facets of daily living. Students with autism had been taught a separate curriculum in the past. This was not challenging, and it did not develop the social skills needed to interact with others. More recently, children with autism have been given access to the general education curriculum and have been taught the same things that children without disabilities are taught. When it comes to instructional accommodations, the general education curriculum must be custom-made based on the child's strengths and weaknesses. Teachers should try and make the daily routine predictable for the child. They should try to develop a schedule that would avoid surprises at all costs. Also, it is a good idea to know how each student handles free time before giving it to the child. Teachers should also try and communicate instructions and consequences slowly and carefully to make sure each child understands. Everyone that is involved in the child's education, including the parents, should try and be consistent when responding to inappropriate behavior. They should use direct statements and avoid using slang or metaphors, as well as nonverbal cues. One of the best validated practices to use with children with autism is the Picture Exchange Communication System, or PECS. This system can be very beneficial in helping these children communicate their needs to those around him. There are 4 initial phases that must be implemented before the PECS system can be effective. First, communication must be initiated. Students are taught that they need to ask for something that they want or need instead of having to be asked by someone else. The student is taught to give someone the picture of the item they want, and then the person immediately gives the child the object. So it could be a picture just like this. I drew a cookie, and the child will give it to the educator, and he will return the cookie to them. The next phase is expanding the use of pictures. The child starts to practice phase 1 more independently, and the range of pictures they can use expands. The third phase is choosing the message within the PECS. This phase's goal is to make sure the child can distinguish between all of the pictures. Lastly, a sentence structure is introduced in the final phase. Picture cards for statements such as I want or I see are introduced into the system. The child can now combine two cards to tell someone what they want or what they see. So, this card right here shows I want. It has a hand grasping for a block. And then they would put it on the strip with the cookie card. And then they would form the sentence that says I want the cookie, and they would be handed the cookie. Next, we're going to talk about technology. Technology can also be helpful in helping children with autism communicate. The technology that is considered useful to these children is not as high-tech as students with other disabilities may need. They fall into two categories: visual supports to help simplify and structure the environment, and augmentative and assistive communication to increase language use. Visual supports help the children to structure the environment around them. Some forms of the AAC can actually produce language for these children. In conclusion, autism is growing rapidly in the United States. Hopefully in the next 10 years or so, scientists can discover more about the disorder and try and prevent it. Autism presents many challenges for both the person diagnosed with it as well as their families and educators. I hope that this has been a very informative video. Thank you very much.